Hi, my name is Ben Sutter. I am a dentist that's been using T-Scan for more than 10 years in my practice as a mainstay of my clinical diagnostics and implementation of treatment. And I'm a known user. I travel and lecture and have shared information with some really talented and smart clinicians from all over. So I'm excited about this book that's coming out. This is the third edition of the T-Scan Technology Applications in Dental Medicine. It is a Bible, if you will, for biometrics and occlusion. And so inside this book, you have a lot of these authors that are sharing their wealth of knowledge from a number of different disciplines. But what I wanted to do today was just give you a touch and a little bit of a preview of the kind of cases that you can come to expect when you get this book and you go through it. And if you're a T-Scan owner, having this and going through it systematically is absolutely going to make you a better user. So my two chapters were comparison of masticatory function in symptomatic patients and control subjects, which I co-authored with John Radke, and then complex medical conditions with an underlying occlusal etiology successfully treated by disclusion time reduction. So these were patients coming in with cervical dystonia or trigeminal neuralgia, Meniere's disease, phantom bite syndrome, where we put them on the T-scan and were able to greatly improve symptoms, if not fully resolve them. So here's an example of one of the cases you can expect. This gentleman came into the office just this week and was complaining of left side ear pain, left side jaw pain, left side facial tension, headaches, and some shoulder issues on the left. And so a lot of us don't want to treat these pain patients, right, with splints or any other type of therapy, because pain is it's subjective, and there's no way to really measure what's going on with the patient's pain intensity or frequency or duration. So these patients remain a bit of a black box, and they get bounced around from patient or from doctor to doctor. So, but put a T-scan in their mouth and you find out that 70% of total bite force is on one side. And so, I wonder if that has anything to do with what the patient is purporting. And this particular patient, one of the dentists he went to built a splint for him. And I had the patient bring the splint into the office because I wanted to measure it too. And this is how the data reads on the splint. And you can see that there's still 65% of total bite force is on the left side. And the patient said, well, it's really not helping me at all. So within about 20 minutes, I had the patient's bite dialed in to something that looks like this. And you're 50-50 plus or minus 5%. Which is acceptable, and for sure this is only a first draft, if you will. So the patient's going to come back, and I'm going to have follow-ups with them. But you can see that I didn't change the sensitivity on this case, but the amount of pressure and force and distribution has been corrected. Okay, here is a little bit more of a bread and butter type case where a patient had 6 crowns across the front. For cosmetic reasons, and this was done by a prosthodontist in her area, and she was having problems with her bite, and they were getting ready to do a neurologic consult and refer her out to one of the university clinics for her to get checked out because she was having some pain issues. And the dentist, in good faith, went and built a night guard to try and help her, and this is the distribution and force profile on that night guard that the patient was suffering with. So again, in a very short amount of time, we made some adjustments to some crowns and some other restorations that she had, and we were able to balance her out pretty quick. Now, some of these scans are simple and modified, and I'm known for having EMGs and JVA and doing a whole bunch of different stuff to really kind of make sure that the functionality of the bite is on par. But I just wanted to keep it very simple. It's just kind of a broad overview. this book also has other topics. I've listed a few here, but it goes deeper than that. The book has all sorts of topics in any discipline where teeth are touching teeth, and gives you cases to illustrate how this can implement and bring your you can implement this in your practice and bring around a better end result for your patients. Knowing all this, if what I've said is interested, but hey, I'm not the kind of guy who's going to take down a 3-volume textbook and just start reading like crazy. Hey, give me the cliff notes. I really want to sit in a lecture for just a couple of days, get what I need to know so that I'm dangerous in my office, and really want to be able to offer a better end result and better longevity in my restorations for my patients, and for my own sanity. There's a couple of dates down here where Robert Kirstein and I are going to be at UNLV. We'll be doing the DTR course, which is T-scan and the bio-EMGs. But you certainly can come to the course and get a lot of information about T-scan and its utilities, because we'll be going through a lot of the science and cases that make it relevant to everyday dentistry. So one of the dates is coming up here pretty quick, just next month, September 27th and 28th. And then there's 2 dates down there for 2025. So you can come and learn with us, and be happy to share with you. If you're interested, you can just reach Shane Varga at TechScan, and he'll be happy to send you my way, and we'll get you registered.